This looks like quite a complex diagram, and looking at everything at once it does look a bit busy, but hopefully you can all label these structures on this cross section of the forearm, and it gives you a great overview of everything you find in the forearm. So to help you think about everything that you can see, I like to start off with the bones. So here we have one bone here and another bone here. We know in the forearm that we have two bones, the ulnar and the radius, and if I palpated my forearm I can feel that the ulnar is quite close to the surface. So we can see that this bone here is in contact with the superficial structures, or a superficial layer, and so therefore this is our ulnar. If this is the ulnar, therefore this is the radius. Like in all of our plastinated sections, the cross sections, we are looking at the person who is lying supine with their feet facing out towards the viewer. So therefore this forearm here is an inferior view of a left forearm. Having that in mind, here we have the anterior aspect of the forearm, so our flexor compartment, and our posterior aspect. This would be the medial side and our lateral side. The black dots represent nerves. These hollow structures with two lines are arteries, so thick walls. These hollow structures having just one line are indicating veins, so thin walls. And all of these labelled structures here are our muscles that we'd like you to identify. To help you along, I identified that this is the skin, and there we have this line here is our deep fascia. So a nerve that's found within the skin would be a cutaneous nerve, and as I've identified, this is the lateral aspect of the forearm, so I might like to call this the lateral cutaneous nerve of the forearm. We have a vein that is running with this lateral cutaneous nerve of the forearm, and if you look at your own forearm, your lateral aspect, you might identify that this would be our cephalic vein. On our medial side, we have obviously a nerve, medial forearm, so medial cutaneous nerve of the forearm. A vein running with it, and we'll identify that this is our basilic vein. And lastly, this posterior aspect of the forearm, and it's a nerve, so perhaps posterior cutaneous nerve of the forearm. So continue on by trying to label your nerves and the arteries that they may be running. Again, if this is the ulnar, if I had to have an educated guess, this perhaps would be an ulnar artery. And again, this is the radius, so we may have something of a radial nature on this side. These are our flexors, so review your flexor compartment, and our extensors. Try to label all of these diagrams and post it on the LMS. And finally, I have some more chores for you to do, some more study. Have a look at these questions. Which muscles are attached to the common extensor origin by the common extensor tendon? This takes into consideration all the muscles of the forearm. I want you to indicate which muscle or muscles will be active during wrist abduction. And finally, which muscles insert into the extensor expansion or the extensor hood.